It is important in the selection criteria that wherever you see the word demonstrated, employers are wanting to read examples of how you personally have undertaken those specific skills. The first criterion is demonstrated high-level interpersonal, verbal and written communication skills. This first criterion is an opportunity for you to show how you have good verbal communication skills within a multidisciplinary context, such as communicating with medical, nursing and allied health staff. It is also an opportunity to demonstrate your ability to communicate and care for patients from a variety of backgrounds, including those from minority groups. You should also emphasise that you are patient-centred and a patient advocate. You can exemplify the fact that you have good interpersonal skills to be able to resolve conflict and negotiate with teams and patients for optimal patient outcomes. Your excellent written communication skills will be evidenced by the fact that you have completed a nursing degree, and also your experience in writing professionally in the patient's medical records. You need to exemplify that you use ISBAR when communicating with the clinical teams regarding a patient's condition. You need to also emphasise how communication skills are critical in the hospital environment to provide safe, effective care. Give examples such as clinical handover, relating medical orders, delegating as a team leader, and problem solving. The second criterion is demonstrated clinical knowledge and clinical problem solving abilities. Here is where you talk about your clinical experience. You can talk about how you have translated the theory learned at university into clinical practice, such as physical assessment skills, medication administration, and identifying patients who are clinically deteriorating. Talk about how you are able to solve clinical situations you are presented with by asking senior staff, ward educators, medical teams, and accessing the ward protocols. Talk about how you are a safe practitioner who works within their scope of practice, and how you reflect and work on areas you feel you need more practice with. You may also want to discuss how you maintain your current knowledge, not only at university, but also when on clinical placement or working clinically. How you keep yourself informed with current clinical policies and guidelines, and work effectively as a team member. The next criterion is an understanding of and ability to work within an interdisciplinary team. Talk about how all disciplines and individuals have an important role to play in ensuring a safe and positive experience for the patient. Here is an opportunity to discuss how all disciplines and individuals have an important role to play in ensuring a safe and positive experience for the patient. This includes the cleaner right through to the surgeon. Interdisciplinary care means that you are all working towards a common goal where everyone is important in the system. Talk about mutual respect, helping one another and sharing the workload to get the job done. Discuss how you have worked in environments where you have been required to work closely with other disciplines, such as medical staff, physiotherapy, speech pathology, and so on, and how good communication is the key to patient outcomes. Interdisciplinary teamwork is also about supporting each other. For example, helping less skilled members of the team become better clinicians. An example could be giving a bedside in-service to junior clinicians. The next criteria is an understanding of the professional, ethical and legal requirements of the registered nurse or registered midwife. Here you need to mention how you are required to work under the ethical and legal frameworks that are governed by AHPRA and the NSW standards. You need to comply with legislation that governs your scope of practice, and how you are required to maintain your clinical currency and competency through practice and ongoing education. You may wish to discuss how you are required to work independently or interdependently, assume accountability and responsibility for your actions and responsibility for actions of those that you have delegated roles. Some other examples include how you are required to provide evidence-based nursing care to your patients. You should mention how you understand the competency standards of the registered nurse and the domains they fall into, such as professional practice, critical thinking and analysis, provision and coordination of care, collaborative and therapeutic practice. Make sure you use the NSW standard documents and AHPRA websites to answer this type of question. The next criterion is an understanding of risk management, safety and quality improvement principles, and the role the registered nurse or midwife has in applying these principles. Some clinical examples of risk management include work health and safety practices and infection control. Some organisational risk management practices include equal employment opportunity and continuous improvement principles. Here is an opportunity to discuss risk management, safety and quality improvement practices in relation to the role as a registered nurse. These may include work health and safety practices or infection control practices such as hand hygiene, personal protective equipment, sharps elimination, and antiseptic non-touch technique to reduce contamination and infection. You may also want to discuss the New South Wales Health Infection Prevention Policy and its role in reducing the risk of healthcare-associated infections, such as multi-resistant organisms. When discussing risk management, safety and quality improvement principles, think about examples that you have been involved in the hospital. These may include infection prevention practices, recognising the deteriorating patient and between the flags, and you may also want to discuss organisations that are involved in improving quality and safety in hospitals, such as the Clinical Excellence Commission and the Agency for Clinical Innovation. So this criteria is how you as a registered nurse use the processes of risk management, safety and quality improvement to improve the care of your patients. The last criteria is a demonstrated understanding of the New South Wales Health's core values: collaboration, openness, respect and empowerment. It is important that you review these core values, which are on the New South Wales Health website, and think about examples how you have practiced as a student nurse and how you will be practicing as a registered nurse under these core values. It is recommended that you type your responses to the selection criteria in a Word document and then copy and paste these into your online application. In this way, you will be able to keep a copy of your responses for your interview preparation. Prior to uploading your selection criteria, please be sure to spell check and ensure that there are no grammatical errors. It may also be opportunistic to get an external person to read your selection criteria prior to uploading. In a nutshell, it is important to develop your answers for the selection criteria, keeping in mind what local health districts want from new graduates. These include: you are responsible, you will work within your scope of practice, that you are safe and will always ask questions. You will escalate clinical issues with patients through the right channels, such as contacting teams and using the ISBAR communication process. You are able to communicate clearly and competently. You will be professional when interacting with patients and other staff, and you know how to resolve conflict appropriately. And you also have an understanding of the local health district core values. You have an opportunity to make changes to your online application at any time between the initial submission and when the application closes. Please see the Transition to Professional Practice Handbook for these dates. For general information on careers, please visit the UWS Careers website. On behalf of the School of Nursing and Midwifery, we wish you every success in your application process.